Welcome everybody to today's video. I actually did a video on this and I was doing some research. I always like to provide links for you to kind of like check out and be able to further research on something. So when looking at, I guess I should start with what made me decide to do a video on nipple shields, because I know I've talked about them before. You know, when I started as a breastfeeding peer counselor back in 2010, nipple shields were not recommended. It was sort of taboo, like to even mention it as an option or a tool. And lactation consultants are usually the ones who diagnose that you need one and show you how to use them, but they'll tell you like if you really do need one. But then I've also known cases where a lactation consultant told a mom that she would only be able to breastfeed with the nipple shield, that she would not be able to breastfeed without a nipple shield. And when I met the mother, her breasts were fine, her nipples were fine, they were not inverted, they were not flat. But I think when she was in the hospital, I think she was probably swollen and her nipples were not like really large. So with all the fluid, she probably had flat nipples in the hospital. She came to me and, you know, she was concerned about her milk supply and she wanted to stop using the nipple shield. And of course, with my training, my goal was to help her wean her baby off of the nipple shield and to get her to the breast. When I finally saw her in clinic, baby was 4 months old, and it's kind of hard at that point to train a baby to do something different than they've always been doing. So it was really hard for her to wean the baby from the nipple shield. When I observed baby feeding and I observed her nipple, it was not flat, it was not inverted, and she should not have needed a nipple shield. It's important to know what a nipple shield is, and there's a difference between a nipple shield and a nipple shell. The nipple shield can be used for a variety of reasons. It can be used because the nipple has sustained some trauma from bad latching or whatever, and so there might be there might be a wound on the nipple, and so the mom may choose a nipple shield at that point while her nipple is healing. Another reason could be because the baby is having trouble latching and has gotten used to a plastic silicone nipple, and so to help them get back to the breast, they start this nipple shield. Another reason a nipple shield might be used is a mom has flat or inverted nipples, and this just helps baby still breastfeed, despite the fact that the baby cannot latch or struggles with latching. In any case, you always want to try to wean off of the nipple shield. It's meant for a temporary fix as you're trying to like retrain the baby. All that being said though, we would much rather the baby feed on the breast than not feed on the breast. So if you're going to use a nipple shield and that's the only way you can breastfeed, then go for it. There are some things to take into consideration. So I am going on a website, which I'm going to link below, and it's kellymom.com. Hopefully I will continue looking at the camera the proper way. First, we'll kind of talk about what a nipple shield is. And a nipple shield it's a flexible silicone type of nipple, and I think I will insert a picture on my thumbnail of what a nipple shield looks like. And again, it's a short-term solution. It's not meant for long-term use. Sometimes nipple shields are recommended in the first couple of days of birth. A lot of these cases, though, the shields are really not needed. They're just handed out without proper instructions, especially instructions on weaning from them. It should generally not be used during the first week after birth, unless, of course, there's an obvious problem, such as the baby cannot latch because of prematurity, or just is really, really struggling with latch and we need to get that baby fed, or sore nipples. I hate to say a flat nipple because this is why another reason why generally the first few days is not good, or that first week, because your breasts are going to be full and your nipples are going to probably be flat at some point because of how full your breasts are going to be. So I don't really like to say flat or a flat nipple, because at some point in time you are going to experience a flat nipple, but you may not actually have a flat nipple. So a nipple shield, really, if it is given to you in the first few days, I would, learn, if you were not given instructions how to wean, I am going to do a separate video on that. And so check out that video. Now, some disadvantages to using a nipple shield is the baby may get less milk if they're not using the shield correctly. Mom is at a greater risk of plug ducts and mastitis because there's not a good milk transfer and some milk can be left in the breast, and this can cause some plug ducts, and then plug ducts that get infected cause mastitis. Mastitis is not something to mess with. If anybody tells you you have mastitis, you need to see a doctor and be, diagnosed with mastitis and get on an antibiotic, because it is an infection. And if you have a plug duct, it's going to be red and sore. But if you start feeling like flu-like symptoms where you just feel bad, you have a fever, you're achy, then and you're having the plug ducts, that's a sign of mastitis. You need to get to a doctor as soon as possible. It can also be difficult to wean from the nipple shield, so that's another disadvantage. And I'm going to add one, and that is that your supply, the duration of breastfeeding is usually less. So a mom who maybe wants to aim for 3 months may not make it past a month and a half. A mom who's aiming for 6 months might not make it past 2 to 3 months, and so forth. So those are some disadvantages. The most important part of this video is the precautions. What precautions that should be taken when using a nipple shield. Be prepared and know how to use it. I have seen success with nipple shield. I think the key to success is these specific precautions, and that's why I say this is the most important part of the video. So let's get right to that part. When using a shield, you really, really need to carefully assess your baby for adequate intake. The best way to do that is to count their wet diapers. Every day they should have at least 6 wet diapers in a 24-hour period. This is by day 6, when they're 6 days old and older. You also want to make sure that they're having at least 2 to 3 stools a day until they're about 5 to 6 weeks old, and around this time it can change. It can become less often. You also want to be weighing your baby frequently just to make sure that they're gaining well. The diaper output is probably your most adequate tool, because the weighing can be kind of hard if you're not weighing with the same scale or same clothes or lack of clothes, that kind of thing. So the diaper output is the best way to know. And of course, as you're going to see the doctor, making sure they're continuing to gain. We're looking for a ½ ounce to an ounce a day. Another really important thing to look for is to listen for frequent swallowing. So when they're feeding, do you hear them swallowing? You should hear like a suck, suck, swallow pattern. And so that kind of is a good indication that they're feeding, and they're feeding well. Another is if your breast feels softer after the feed. So when you feel the breast is full and then afterwards, does it feel like the baby emptied the breast? And this is where this is what I had this mother do, and she did make it to 6 months, the story that I was telling earlier. She made it to 6 months. I told her she needed to pump after each feeding, because that's the best way to ensure that the breast's empty after each feed. Because the baby doesn't transfer milk very well through a nipple shield, when you pump after, you're ensuring that they're emptying that breast. And the reason that's so important is any milk that's left in the breast can tell the body we don't need it anymore, and so it makes less, and we don't want that to happen. So that is probably one of my biggest suggestions for you, to make it successful is to pump after each feeding. The precautions then are making sure the baby's going through the diapers, having the plenty wet and stools, also the baby's gaining well, and the frequent swallowing. You want to hear the swallowing. And again, if the breast feels softer, it's kind of hard because some women can't tell that the breasts are full. So that's why it's just to be err on the side of caution and just pump after each feeding until you feel like you're at a good point where you know your milk is well established. But I would always follow precaution and make sure and be checking to make sure that your milk is adequate and that you're keeping up with the baby. That's pretty much it. I hope that this video helps. Like I said, I'll put the link to the article down below. I usually try to find 2 or 3 articles just to kind of like give you something to look at. I'm going to do a video now on weaning from a nipple shield. That one shouldn't be as long as this one. I'm going to try to cut this one down some, but I hope that helps. If you have any questions or concerns, please feel free to comment below. If you felt that this video helped you, hit the like button. And definitely, come back and check out my other videos. If you hit the subscribe button, it doesn't cost you anything, but you will then be able to see the videos as I upload them. And if you hit the little bell next to the subscribe button, that notifies you whenever I put out a new video. Because it's a breastfeeding channel, I don't typically put out like a video a day, and sometimes I don't do a video a week. It's just, it can be, a month can go by without me putting out a new video, but I try to get them out at least once every 2 weeks, but my aim is always once a week. So it's just that there's only so much you can talk about, and then it's kind of like finding things that might really help a person. And so I'm just always researching and trying to make sure that I keep up to date on things and put out updated information. So definitely hit the subscribe button, the bell if you want to be notified when the new videos come out. The subscribe button typically will notify you like when you open YouTube, but if it's been a while that I've put it out, you won't necessarily get a notification. So if you hit the bell, then you'll be notified by email and also by YouTube that I put out a video. So again, thank you guys for watching, and I will see you guys in my next video.